Namaskar. I am a pediatric cardiologist who is currently practicing in the United States of America. And I first want to start off by saying that my heart goes out to India and all its people. We have been, the whole world, and now India has been taking a beating from this pandemic for the last almost 1.5 years. It has disrupted every way and form of our lives. It has taken away the most important people from our lives, and we need it to stop. But if we need it to stop, we have to think logically and scientifically, follow the guidelines. I start off by dedicating this video, which is educational only. Please do not base any treatment or any way of its form on this video. It's purely educational, and I dedicate this video to all those who have lost their lives fighting, yet they have given us information and education, and their lives which have been lost are not in vain. So the single most way that this virus is spread is through the respiratory system. We need to keep away from people, so we need to maintain a 6 feet distance from someone. We need to be wearing a mask, preferably one that is a medical mask or an N95, and if this is not available, a cloth mask is also okay. The mask should cover, preferably if it has a nose piece like this, should cover the bridge of the nose, and then you need to mold it to the upper part of your nose. It needs to cover as much space here, and then needs to have a good seal over here and at the bottom. It is of no use to wear the mask up, down, sideways, on your hand. It needs to be worn in this way to be effective. To be more effective, especially if you're using a mask that is not a medical mask, is to double mask with the same amount of coverage. The mask needs to be worn every time you are outside, and also if you are COVID positive inside the house, so that you can prevent your loved ones from hopefully getting this virus. The mask should not be removed when you're trying to speak or walk or sing or talk to someone. It is very important to continue to wear this mask at all times, especially when you're sneezing, coughing, speaking in a loud voice, so on and so forth. For adequate hand hygiene, we are looking to wash our hands at least for 20 seconds with soap and water. And when you're washing, you want to make sure that you're covering all parts of your hands. On this side, this side, this side, this side, in between the fingers. Keep your fingernails short and scrub in between, and preferably scrub each individual finger and at least up till your wrists. This is important after coming back from outside, even when you're outside, you've bought groceries, so on and so forth. As much as you can do it, please do it. If you're able to get a sanitizer gel for those times that you cannot wash your hands, please get that also. Washing hands with soap and water is still considered the standard for maintaining hand hygiene. In order to avoid getting COVID, it is important to avoid overcrowded spaces like religious temples, churches, mosques, where a lot of people congregate together, or malls, cinema halls, even roads and big celebrations, family activities or family celebrations like birthdays and weddings. All these are super spreader events and need to be avoided, especially during the surge that we are facing right now. If you have been diagnosed with COVID, or you are experiencing any upper respiratory infection symptoms such as cough, shortness of breath, fever, loss of smell or taste, diarrhea, abdominal pain, any rashes, sore throat. If it is possible to get yourself tested for COVID, that would be ideal. Even if you're not able to get tested for COVID, you are waiting for your COVID test, it is important to again follow all of the measures we talked about: social distancing, masking, and good hand hygiene. You always presume that you have COVID and the people you meet or interact on a day-to-day basis have COVID. If you have been diagnosed with COVID, if you have mild symptoms, all of the symptoms that I had mentioned without any oxygen desaturation, which we check with a special machine, at that time you continue with the social distancing, masking, hand hygiene. You can stay at home, hydrate well with water. You can treat the cough with any anti-cough medication. You can treat the fever with any acetaminophen or anti-fever medication. Taking vitamin C of 500 milligrams will be of benefit. Some articles have shown taking vitamin D also in a person especially who's low on vitamin D will be of benefit. You need to have thermometer at home to take your temperature and a pulse oximeter, which there are different kinds, but mainly the ones that you find are put on the finger, and you monitor for oxygen saturations. This can be done at home. There is no need to panic. You stay at home so that you can leave the clinics and the doctors to take care of more severe patients. So when you're using a pulse oximeter, you're looking for the number. Usually the number is between 95 to 100. In order to go to the hospital, you're looking for a number less than 92. If it is just temporarily less than 92, not persistently, that means it is not continuously less than 92, you can still wait at home with the symptomatic management. If at any point you feel there is difficulty breathing, or your cough or your shortness of breath is constantly or consistently worsening, and it's been more than 5 days, at that point, it may be time to make your way to the hospital. If you are a person who has increased risk, that is, you have diabetes, high blood pressure, heart disorders, history of stroke, an age of more than 60 years of age, any liver or kidney disease, or any immunocompromised condition like you are a cancer survivor, you are taking immunosuppressants like steroids, or if you are morbidly obese, you have a BMI more than 40, you may be at increased risk for having complications of COVID. Please monitor yourself closely, and it would be important to go to the hospital as soon as your symptoms get more than mild. If you have moderate COVID, that means your saturations are less than 92%, and you are having progressively worsening shortness of breath or cough, at that time, you go to the hospital. In the hospital, they will monitor your oxygen saturation and give you oxygen as per protocol. Their protocol would be to maintain your oxygen saturation between 92 to 96%, and they will use a method called a non-rebreather mask is what they will try to put you on, or a nasal cannula oxygen. They may also have you, when you are awake, have you lay on your tummy so as to allow for the bottom portions of the lungs to get oxygenated and for blood flow to reach through them. At this point, depending on the symptoms, your doctor may decide to treat you with steroids, low molecular weight heparin, or aspirin. They will monitor you and take serial chest x-rays and check for other lab work for kidney with regards to plasma. As per the AIMS protocol, which is what I am referring to, it is most useful when used within the first 7 days of the moderate illness. The plasma quality needs to be high. There has to be certain criteria met so that the COVID antibodies are high in that plasma. Stockpiling plasma, keeping it for oneself when one is not sick, might be very detrimental for the public, where they need the plasma and can save many lives. If your saturations are less than 90%, there is a good chance that you may be admitted to the ICU. In the ICU, they are monitoring for your respiratory effort. That means the effort you're taking to breathe. And if you have trouble breathing, they will increase your oxygen support. They might start with a face mask of oxygen, and then go on to give you a high flow oxygen before increasing and intubating you, which is to put a breathing tube down your airway and a machine breathes for you, acting as your lungs till your lungs can heal and improve. In the ICU, they may also use the methods that we use to treat moderate COVID, which is with steroids. And they will also do symptomatic management, like give you fluids, support your function of your heart, and will also do anticoagulation, which is to keep your blood thin, with heparin. If your symptoms are increasing, they may do a high resolution CT of your chest to see what your lungs look like. They may also use a medication called remdesivir, which is used for moderate to severe symptoms. It is best used when within the first 10 days of the illness, and if you don't have any kidney or liver impairment. Tocilizumab is another medication that you can use in the case of severe disease, especially if your inflammatory markers, so your doctor will check markers like CRP, and if they are very high, and if you have not had a good response to steroids, they may consider this medication. It is preferably given within 24 to 48 hours of an ICU admission. It is important to make sure that you don't have any active bacterial or viral or fungal infection before this can be given. You're going through a very, very difficult time of your life, fearing for your own life, of your children, and of your relatives. Even though that is the case, the only way you can help anyone is by not panicking. Please follow guidelines. Please follow rules. It is important to maintain a healthy diet as much as possible and increase as much fresh fruit and fresh vegetables in your diet to make sure that you are healthy in case you do get the illness, so that you can fight it. Please listen to your doctor or your medical facility as to the treatments that they are suggesting. Avoid causing any agitation in a treatment setting. Also, the next part of what I'm going to be saying is very difficult to hear, and I apologize in advance for saying it. But in this process, we may lose someone very important to us. Please maintain as many minimum people as possible for the funeral. Ensure all COVID precautions, which is social distancing, hand hygiene, and masking during these procedures. You don't want to get the disease from the person, and you don't want to spread it to others. Let us fight this together. The United States went through this a few months back, and we all reeled in it for 2 to 3 months. It is going to take months for normalcy to return. But panicking, stockpiling medications, harassing medical professionals, and also clogging up medical facilities when not needed, all are not going to help us. I sincerely wish this very painful time will come to an end as soon as possible. I have used the AIIMS protocol for treatment for education in this perspective. I hope this was useful, and I hope that I can answer any questions that you may have.